I feel like everybody in the mental health and brain enhancement world is on the keto bandwagon these days, but you are not. Tell me a little bit about that.
I am not. So, in the clinical setting, the diet that we tended to teach all of our patients was the Mediterranean diet. And why is that? I mean, it's in the peer-reviewed evidence-based literature. It's been shown to reverse cardiovascular disease and reduce your risk of neurological disorders. And that's our whole goal. How do we help support your brain health? And you want to do that through healthy whole foods, right? Fruits and vegetables, nuts and seeds, legumes, omega-3 fatty acids. So when it comes to keto, and I'm very open-minded about this, if we have patients who have epilepsy or seizure disorders, the appropriate use of keto for those addressing those disorders, I would absolutely support that. And I know people do use keto if they have cancer or going through chemotherapy, again, to reduce sugars in the diet. But it's also been my experience in people who are on keto that we've seen elevated levels of LDLs and cholesterol. I mean, the
Mm,
lipid profile
mm.
can really get off kilter. And some people have then had to go on statins or Repatha or medications to help manage that. So I
Yeah.
think you really want to be mindful. If you want to explore that and do it, I'd say just make sure you get your labs done, probably every 3 months, to make sure that whatever you're doing isn't silently elevating levels of especially your lipids and saturated fats that can lead to atherosclerosis. I just want to make sure your cardiovascular health is not being impacted. And that's just being mindful. So
Mhm.
I, as you and I were talking, I'm open-minded to whatever dietary patterns that you want to follow. I've just learned through teaching thousands of people about how to take care of the health of their brain. I stick to more of a whole food, plant-based protocol.
Mhm.
We know in the evidence-based literature, the foods that are best for your brain health are fruits and berries like strawberries, blueberries, blackberries, and green leafy vegetables. So, and you can't refute that. Those are healthy, those are living foods that contain water and enzymes and living enzymes, and we need those. I mean, we need these living foods to keep our brain functioning optimally. Most people don't realize the brain's the most metabolically active organ in the body, and it generates a lot of free radicals, and we need to quench those with phytonutrients, and you get those through plants and fruits
Yeah.
and vegetables. So if you're going to go keto but you love your brain, just keep all of this in mind.
Yeah, I think if like you were saying, if you're going to go keto and you love your brain, then
Yeah,
your sources of fats have to be avocados, nuts and
avocados, nuts and
seeds,
seeds, yeah,
MCT oil, olive
olive
oil.
oil,
But
coconut oil,
yeah, but you
just
cannot be going crazy on
the bacon,
cheese, sausage,
the dairy,
bacon,
yeah, the full fat milk.
dairy. Yeah, so many people take it as a license to just go nuts on animal fats, kind of saying, oh, well, actually, it's not as bad as we thought. But I think the medical community is pretty much in agreement that it is as bad as we thought.
I think so.
You
I
know?
mean, when the ketogenic diet was really big and we were looking at it in the clinic, I mean, we tested patients on it to see how well they've done. It's hard for people to stay on that long term.
Yeah.
Inevitably, people come back to wanting some fruits. They want some carbs, and your brain needs glucose as its fuel. So again, I'm a scientist and I'm actually very open minded. So, if keto is working for you and your blood lipids tend to stay in a healthy range and your cholesterol is not rising, or you might be young. So, that's the thing. When you're young, your brain and body can handle a lot more. As Dr. B and I know, when you start getting to be our age and older and you take care of people, I mean, most of the people that I see, they have degenerative diseases, right? They
Yeah.
have ALS, they have MS, they have Alzheimer's. So the diet I'm going to put them on is Mediterranean, because
Yeah.
that is really what supports supports your neurological health. And it's easy for people to do, and you lose weight on it. I've helped thousands of people lose weight. It's very easy and it's modifiable. So if anybody wants the dietary protocol, I'm happy to share it with you as well, because I'm just here to help people have the healthiest brain possible and make it as easy as possible.
Yeah.
But the
Yeah.
saturated fats, we want to keep the saturated fats down. And
Yeah.
I think most of us are in agreement. No, do we need cholesterol for healthy brains? Yes, we do. That's why we
Right.
do need the healthy fats. And so please get some form of omega-3 fatty acids in your diet, or get some sort of fish. You need the omegas. They're really critical.
Yeah. Agree.
Keep your brain volumes. You want a nice brain volume, and they're important in keeping your brain, you know.
Yeah. Nice chubby brain, right?
That is the first I've ever heard of it like that. But yes, if we're getting an
Lots of
MRI on your
volume.
brain, I want to see that your hippocampal volume is in the 90th percentile, not in the
Yeah.
5th percentile. I was like, how do we keep this brain looking good? We need,
Yeah.
what's funny? It's just the small things you do practice daily
Yeah.
that really have the dividends in the long run. And that's why I love what you do, because I know you teach your community about brain health. Here's the things you do every day. Here are the foods you eat, get the magnesium in through the foods. With the supplements, by the way, if you can get everything in through your foods, I don't need people to take lots of supplements, but I've realized in my experience, most people need them by the time they're 40, if not 50.
Yeah.
So if you're listening and you're just dipping your toe into the supplement world, start with the basics, get a foundational multivitamin and omega-3 fatty acid and vitamin D.
Yeah.
Even that, and if you just did that daily, and come talk to us in a year or 2 years.
Yeah. You're going to be ahead of the game just for fixing
Well,
it will fix so many common nutrient deficiencies.
or the homocysteines,
Yeah.
patients that have
Yes.
Alzheimer's, right? But what
Exactly.
brings homocysteine down? B complex, just your B vitamins. So
Right.
you'll get that through a multi, because I can't trust that everybody I'm talking to is eating a clean diet. But I
Right.
know if you're doing the supplement, and because I've seen in the clinical setting using neuroimaging, these work and make meaningful changes that last. They have sort of, and the things that really change the brain, if you get the book, they're going to be the ones in the injured reserve section, the ones that really help bring the blood flow back.
Hmm.
But I wrote the book so people would have the guidelines. This is what we do in the clinic. This is how easy it can be. Just, you need to practice it daily.
Right. It's all about those daily habits. The
Yeah.
Titanic only needed to change direction by 1 degree to avoid disaster, just one
That's a
degree.
great point. I love that. I tell people, so I work with firefighters,
Hmm.
and what's interesting in that community, the one change they made was after they wore their protective gear, they learned to clean it after they would go
Mm.
out in fires. So the old school firefighters, my dad was one of them, and he
Hmm.
ended up getting Parkinson's. So I tell the story. They never cleaned their gear. And the fire
Mm.
community tends to get higher rates of cancer and
Oh,
Parkinson's disease, but they made the one change, cleaning their gear. All those rates start to drop. And I
wow.
liken it, that's what I liken to like doing a green juice every day, right?
Mm.
Drinking the appropriate amount of water every day, just half your weight in ounces of water. You know, having, a cup of blueberries every day. There are these small habits you can do, but if you do them every day, they truly add up and you'll
Mhm.
feel better. So the whole goal, you're helping people with migraines and headaches feel better. They're looking for that relief. Sometimes it's there's a hydration piece that hasn't been
Mhm.
adequately addressed. Or I know it goes deeper than that because I've worked with this population too, but the small habits really help.
Yeah, they sure do. And it's just, gradually sculpting your daily habits to be
Yes.
maximally supportive of what your body needs. And then over time, your body adjusts to this new norm. It heals all those problems underneath the surface, and you start feeling amazing.
You feel amazing. You
Yeah.
wake up, So I'm over 50, and anybody that I work with, the first question I ask is, how do you feel in the morning? Do
Mm,
you need to wake up and grab a cup of coffee, or do you already feel energized? I want people to sort of work with their natural reserves. I don't want them to have to reach to something external to
mhm.
keep their bodies going,
Yeah.
because that tells me there's something foundational that I need to correct. And so I think the things that you teach your patients and the things that I teach, I try to correct the foundational deficiencies, and it's quite easy to do. And then
Mhm.
people come back and they feel better. And then we have our other technologies, right? I have the neurofeedback, you have all of your practices, and then you've got the medications as well. And we sort of combine them to really help people get the best outcome possible. And in
Yeah.
psychiatry, trust me, that is very hard to do,
Yeah. Yeah.
right?
Exactly.
Optimal outcome is our goal.
Yeah.
How do we get you healthiest, the fastest, with the least side effects, right? And that's the goal. So, and that's the goal here. That's why I think you and I are probably champions of brain health, right? It's just,
Yeah.
the more you love your brain and take care of it now, it will reap dividends later, because probably most people
Absolutely.
listening here are going to have extended lifespans. I
Hmm.
do feel like we're going to live longer than 78 is the average lifespan right now of a male in the US. Males, and I think females right around the same number. I think we're going to extend that. We'll probably make it to 80, 85, 86.
Yeah.
So doing these things now and getting the good habits in place will help promote your health span, and then we won't have to see you in the clinic with a degenerative. That's the whole goal. Like,
That's
how do
right.
we
That's
help
right. Yeah.
prevent any neurological issue from happening later on? So,
Yeah. Well, thank you so much. You are just a fountain of knowledge. I appreciate you
oh,
so much sharing a little bit of your time and expertise with us. If people want to find out more about your work, what is the best way to find it?
they can find me on my website. So it's drwillemeyer.com, or I actually have two that go to the same website, willemeyerneurosciencecenter.org.
Thank you so much for being here
Thanks.
today.
You're
I really appreciate it.
welcome.
Yes,
And thank you
wonderful.
for your great work too.
Oh, thank you.
I
I
love it.
appreciate it. Yeah. All righty. Take care. Thanks again.
Thank you. Bye bye.
Bye-bye.